In Colorado, state and community partners are working together to strengthen early childhood services in the San Luis Valley so families can get the care and support they need for their children to grow and thrive.
This work means that families will be treated in the way they need to be treated, in a way that they feel empowered and heard and seen in a way that maybe they haven't been in healthcare before.
The improvements that I see is definitely parents just having more knowledge, parents being empowered, parents realizing that they're doing good for their child.
In the San Luis Valley, one of Colorado's most rural areas, families often encounter obstacles when trying to get the care they need. But local health systems, early childhood nonprofit organizations, and state agencies are creating new referral pathways to improve care coordination.
The e-referral project would expedite and ensure that families are more likely to get connected to evaluation and eventually services.
When you can speed up the process from the time they have the conversation with somebody about a referral being made, you can more quickly address concerns and answer questions.
It is an incredible infrastructure that's already in the valley. They are resource rich when it comes to connections and relationships.
The positive thing that I've seen out of all of it is the community wanting to work together. Collaboration is huge.
Partners are expanding Healthy Steps, a team-based care approach, to new clinics across the San Luis Valley. This model helps families foster healthy child development and lifelong well-being.
Healthy Steps allows a trusted partner in the health system to support these families in understanding the developmental nature of a young baby.
We did expand Healthy Steps to 2 additional clinics. It is a framework for delivering high-quality, well-child care to young children and their families.
The Irving Harris Fellowship and other training opportunities are increasing the number of early childhood professionals who can provide a continuum of supports and services for infant and early childhood mental health.
We've tapped into experts to really enhance their knowledge, capacity, competence in perinatal, infant, and early childhood mental health.
We have been able to provide that training, professional development, and support for someone that is a behavioral health, professional, and now they have the early childhood skills and knowledge to be effective, with families.
State and community partners formed a family co-design group to bring caregivers' unique experiences and ideas into shaping better early childhood services.
We've been able to get concrete feedback from families who would be accessing the services.
I help bring up new ideas to help with the health systems here to see what we could change. I have 2 kids and they are both in the health system, and for me it felt like a time that I could put in my fears and my feelings of what's going on in the doctor's offices.
In Colorado, state and community partners are working hand in hand with families in the San Luis Valley to strengthen early childhood services so young children can grow and thrive.
It's making sure family voices and community voice is elevated, making sure that, families are getting the services and the supports that they need, where they need them, when they need them.
Learn more at coloradoabcd.org.